Welcome everyone. Thank you for joining us today after a bit of a break. I am Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. If you would like to review our media updates via email and receive these updates, please subscribe to our website at WECHU.org. You will get alerts, news updates, and the most current information 7 days a week. I will now share the most current case counts. There are 27,063 confirmed cases of COVID-19 in Canada and 7,953 cases in Ontario. Chatham-Kent has 25 cases and Sarnia-Lambton has reported 119 cases. Michigan now has 27,001 cases with 7,004 cases in Detroit. Today, we are reporting 59 additional confirmed cases of COVID-19 for a total of 408 cases in our community. 32 people have recovered. 19% are between the ages of 50 and 59, and 18% of our cases are 80 years of age or older. 36% are male, and 55% are female, with 9% being unknown at this time. We are sad to report 3 additional deaths due to COVID-19. Our community has lost a total of 16 people to COVID-19. 10 deaths have occurred in long-term care and retirement homes. Our health unit continues to work with 6 long-term care and retirement homes that are currently experiencing COVID-19 outbreaks. 34% of our total numbers of cases are associated with long-term care and retirement homes. The health unit continues to follow up directly with everyone who has tested positive and negative for COVID-19. Soon there will be the availability to access your results through the online portal. This option is not available at this time, so for now the health unit will contact you by phone to give you your results. We would like to remind you that if you have been tested and are awaiting results, you are to remain in self-isolation. Overall, 2,701 individuals have been tested for COVID-19 in our area, and of those tested, 303 tests are pending. The testing should be based on clinical assessment, and these testing guidelines have been updated with an emphasis on testing symptomatic residents of long-term care and retirement homes. Guidance from the Ministry of Health requires testing of asymptomatic people without symptoms who are now admissions or readmissions to these homes within the first 14 days of admission. Residents being transferred from a hospital are to be tested prior to the transfer back to the home. All residents will be required to remain in self-isolation for 14 days following the admission. During the outbreaks, testing increases to include asymptomatic residents who are contacts of the ill resident with COVID-19. Our health unit will continue to work with these homes to support infection prevention and control measures, outbreak management, and testing. Healthcare workers, caregivers, care providers, and first responders should be tested as soon as possible if they develop symptoms. Certain groups have been prioritized for testing in the event of shortages of testing supplies. These include symptomatic healthcare workers and staff who work in healthcare facilities, symptomatic residents of staff and staff in long-term care facilities, hospitalized patients, symptomatic members of remote, isolated rural and Indigenous communities, symptomatic travelers identified at a point of entry to Canada, and symptomatic first responders, including firefighters, police, EMS, and also individuals referred for testing by our health unit. Please continue to visit WECHU.org for the most current information and to receive updates. Symptoms of COVID-19 include fever, cough, or difficulty breathing. However, other symptoms may be present, such as being extremely tired, falling, having nausea, vomiting, or headaches. If you are feeling unwell and need a health assessment for COVID-19, there are 3 options. Complete the online self-assessment at ontario.ca, contact Telehealth Ontario, or contact your primary health care provider for a phone assessment or a virtual assessment. They will be able to guide you to next steps, including contacting our health unit or attending an assessment center. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. I would start my update by first thanking to all our healthcare workers, first responders, essential workers, who are still working and ensuring the community is safe and have the basic essentials needed to survive through this unprecedented times. Thank you for all your hard work. This is not over yet, and we need your continued support through this difficult time. As you can see that there is a significant increase in the number of confirmed cases of COVID-19 in our region, bringing our total to 408 cases. In addition, the 3 additional deaths in the community, and none of these deaths are related to any of the long-term care home and retirement facilities. A male and female in their 80s and 1 male in his 70s passed away yesterday. Our team at WECHU would like to express our sincere condolences to each family experiencing for their loss of their loved ones. This is not easy to report any death in our community. We've received a lot of questions and requests to provide more details about individuals who have passed away, but we want to honor the privacy of the families experiencing this traumatic loss. It is a difficult time for them. Any loss of life in our community is very difficult to handle and accept by anyone who is living here. Since last week, our focus has been in the long-term care homes and retirement homes, and we have seen the number of cases going up in those facilities and also some positive stories from these homes. We were able to rescind COVID-19 outbreak in 2 of the facilities in our region, Riverside Place and Village at St. Clair, and we will continue to work with the rest of the facilities that are currently in outbreak or the other facilities that are not in outbreak for early detection of cases and early isolation of individuals to limit the spread of the COVID-19 in our community. These homes must continue to do the active screening of all their residents, that is, taking temperatures and monitor their symptoms twice a day to pick up these cases early and isolate them by taking appropriate infection prevention and control measures. Staff must wear procedure masks all the time in case they develop symptoms and they do not spread it to other staff members or to their residents. Staff must adhere to strict personal protective equipment use as per infection prevention and control guidance and do not come to work if they have any symptoms. We must continue all these measures to contain these outbreaks quickly and prevent other outbreaks from happening in the first place. While in the midst of this pandemic COVID outbreak, municipal leaders are also bracing for potential flooding. According to IRCA's April 14th alert notice, they are monitoring several shorelines and areas of concerns for flooding. Both Lake Erie and Lake St. Clair have started off April with record-breaking high water levels. Floods can cause extensive damage and risk to the health and safety of community. At this time, during the COVID-19 pandemic, first responders, hospitals, and other services are already taxed and very strained. It is important that the residents plan accordingly for potential flooding, not only to reduce their risk of injury or severe health outcomes related to flooding, but also reduce the potential burden on the emergency services. To ensure you and your family are ready for potential flooding, the WECHU recommends you to make a plan, which is make a family emergency plan, including potential evacuation. Stay informed, monitor your municipality website, IRCA, and the news for alerts. Get your home ready. Install weather protection, sealant, sump pump, and zero reverse flow valves. Create an emergency supply kit that should last you 3 days of supply of water and non-perishable food in case if you need to evacuate or if you run out of power supplies and cannot leave your home. For more information, please visit our website or Essex Conservation Region website for further details on flooding. Thank you.
We'll now take questions from the media. We'll start with Blackburn.
Hi, yeah, you keep talking about active screening at the long-term care homes. I know it's mostly to prevent further spreading, but does early detection help with the treatment or outcome of patients?
Treatment, we do not have any treatment, but definitely the outcome of the patient. The idea behind early detection is we can isolate these individuals. When we are talking about any kind of public health measures, the moment we have a case, focus is how do we contain that case from spreading to other people, and identifying the contacts who may have been in contact with that original case, and keep those individuals in a place where they cannot spread it further. So early detection of these cases would definitely help to put appropriate infection prevention and control measures around those individuals to contain them before it spreads further.
But it doesn't help them in any way in the sense of like their personal outcome of whether it's a positive outcome for themselves personally.
Well, I guess, again, if we are so there are a couple of questions. So one is the clinical question, if these people are picked up early in their symptoms, and if they are connected with the healthcare providers to provide them with the care that they need. Sometimes it could start very quickly, and then they can get worse. Having those identification early, that if this person is COVID positive, it can lead to more discussion with their healthcare providers in terms of their needs. If it needs that they need more clinical care, more support, hospital care, or ICU care, they can be immediately referred to those services. So I wouldn't say that it doesn't necessarily help. It does help, but I think it really depends on the individual circumstances.
Any questions from the Windsor Star?
Yes, thank you. Good morning. 59 new positive cases is a pretty significant jump, as you mentioned. Do you attribute that to the same things as you did yesterday, as more targeted testing in long-term care homes and a backlog in lab results, or is this something new?
No, it is as a result of our active screening. We went out to these facilities over the weekend, and we tested pretty much everyone in the homes just to make sure that we have a good baseline on these facilities. And as expected, we picked up more cases, and that's what we are reporting. And as a result of that, we will be doing more testing in many of these homes. We are going to another home today, and we'll continue to work through our way to make sure that we are getting all those active screening in place to make sure that we are able to diagnose these cases early in our community.
I've seen some people even in the comments on the live Facebook feed right now talking about how they see this as flattening the curve, not actually happening, that the measures aren't working. What would you say to those people specifically?
Well, I guess if you're really looking at the breakdown of what's happening, where these activities are happening, if you're looking at the cases in the community, we did see a decline in the number of cases in the community, but we have seen an increase in the number of cases in the long-term care home. So that is telling on its own that now we have a vulnerable population, and having any outbreak in these type of setting is very difficult to contain. It spreads like wildfire, and if one person is positive, it leads to more cases, and that is why this early identification and strong measures are needed. We have made several recommendations right from the beginning, including the limiting of the healthcare workers to work in one facility. Maybe we were late in that before it all started. So I think now things are in place. The ministry guidance is in place. Our active screening is happening. Healthcare workers, they know that they have to wear a mask when they're going in those facilities. So all those things are in place, but maybe we were slow in having those measures in place, and we will continue to see what else additional measures that we can put in place to make sure that we are staying on top of things and support these facilities in managing these outbreaks.
Thank you.
Any questions from CBC?
Yes, good morning. I know you reiterated that 10 of the 16 people who died were in long-term care homes. Can you go through which places had these deaths?
So we've mentioned earlier that all these we try to respect the privacy of these individuals and honor the privacy of the families experiencing this traumatic loss. There's really no benefit in knowing which of these facilities are there, but the word is already out there. It's from our reporting perspective, I think we are taking a responsible approach in terms of respecting the privacy of these individuals. These are people that we are talking about. These are not the numbers. It doesn't matter where they are. A life lost is a life lost for our community, and we should be paying attention to how do we prevent those lives from losing their lives, and that's what our focus should be instead of focusing on where these individuals are.
There are other homes in Ontario that are providing that information. So you're saying that you're protecting their rights, their privacy.
I am focused on my community. What is in the best interest of my community, and then, as I said, from a really action perspective, the facilities know which facilities are in outbreak, and measures are in place to contain it, and that's what our focus should be, and this is what we are focusing on right now.
Okay, thank you.
Any questions from AM 800?
Yes, in the beginning, when we were seeing the issues with the border, there were quite a number of cases of healthcare workers crossing back and forth that were infected. Is that still a concern, or are you seeing the number of those cases decrease?
So we started looking at that number, and we will present our most up-to-date summary this weekend as well, and we will be able to share that breakdown of those healthcare workers and what it looks like in our community. It is a healthcare worker, if they're infected, the likelihood of them spreading is much higher than anyone else. I think that's why the concerns about these healthcare workers crossing the border and having measures in place to avoid healthcare workers working on multiple locations, those are the key factors in controlling and containing the spread. If it spreads to one facility, how we are containing it to the other facility. So that efforts are still there, and we want to make sure that people are following and adhering to it. And when they're coming back, especially from the border, they are doing the home self-isolation throughout this period until we get a better handle on this pandemic outbreak.
Thank you.
Any questions from Windsor?
There's a lot of talk out there about how COVID-19 disproportionately affects people with other underlying conditions. Of the 16 deaths so far, have you seen a lot of underlying conditions in these people?
Well, I can broadly speak that yes, each of these individuals have underlying conditions, and that's what resulted in their death. But we will be doing more analysis on those cases, and we'll try to provide a breakdown of those in our weekly summary. But even from other regions, what we know, that is the case. It has to, most of these individuals who have lost their lives, they are elderly. Our cases, similarly, like all of them are older than 70 and have some kind of underlying medical conditions. But we will try to provide a breakdown, if available, to in our summary this Friday.
Any questions from CTV?
Yeah, I just want to pick up on the nurse thing. I've been hearing a lot lately about American nurses. Like, a lot of them aren't on the front line, and a lot of them feel discriminated against because they can't go to the bank. They can't go grocery shopping. One tried to give blood apparently and was turned away. So a lot of the healthcare professionals that travel to the States are feeling discriminated because they're not on the front line. They're not at a high exposure, facility. So what do you say to them?
So I think it's unfortunate, and I have a huge respect for those people who are crossing the border and going there, despite knowing the risk that they're putting themselves into. They have a strong work ethic, and they are doing what they think is in the best interest of their patient to be there and to support them. And so what what happens is still, if they have to follow the work home self-isolation, they shouldn't be going to the banks and the other places and make other arrangements. And I'm sure that there are other community members or community support agencies that can provide that kind of support. So I think it is even in their best interest to try and follow that carefully. But for people who are looking them that they are the cause of the problem, well, they are not. I think they are trying to do what is best in their professional opinion. It's their role, it's their job. But I think what we need to do as a community is to put measures in place to prevent the risk of spread in the community, which we are doing, and we will continue to push forward for that to make sure that these people are being taken care of and they are doing everything that they need to protect our community in the best possible way.
So basically, you got to blanket it because what's good for one is not good for all. But that's what they think. But at the same time, you got to blanket it just to take the safety measures in place. Right?
Absolutely, because I think that's why some of these measures are in place when we are talking about these physical distancing and all those control measures. It is applicable to everyone, and I think we should be strictly adhering to it. Without that, we won't be able to contain it.
One more, just going back to the flooding part. The second day that really brought up the flooding, and I'm just curious, is there a hot spot? Are there spots that you are concerned about, or is this kind of a blanket for the whole community just to say, hey, whether you're inland or near the shoreline, be careful and have a backup plan?
Well, I think as part of the emergency planning, I think we need to understand that everyone should be prepared for the emergency. So when the COVID started, there has been some efforts from individuals to stock up some of the food. Maybe that was disproportionate response, but I think that response is necessary at least for a short period of time, to make sure that if something, because it's very easy for the flooding. We have seen flooding in Windsor as a result of heavy downpour rain a few years ago. And when the lake levels are high, there is no exit for water to go anywhere. And depending on what is coming in the spring, which we can expect more rain, and then where will this water go? So it's not a problem just for the shorelines, but it also for the entire community. Some of the shorelines are seeing the impact right now, and so those people are at a higher risk at this point. But generally speaking, it's the entire community who's at risk, and we should be prepared and making sure that we take all those proactive action, and that's what the whole message is. That get your home ready, and if you have some of these things that you need to take care of, do it right now before it actually hits you.
Okay, so people love timelines. So I'm just worried that by you saying this, people are going to run the Costco or they're going to run to whatever store, and everybody's going to start stocking up on toilet paper and whatever else they're going to do, just like they did a month and a half ago. Like we're not putting fire under people's butt right now to get going, are you?
Not at this point. I think it's something that IRCA is monitoring, and then they're issuing those advisories. There are municipal officials who are taking this, looking at it very carefully and issuing advisories accordingly. So I think it's not that something is happening tonight or tomorrow, but I think it's something that people should be thinking and start to plan accordingly, not to jump and rush to those facilities and get the stock up your house, but thinking proactively. I think it's time that we need to take care of this emergencies and be more proactive. And that's the whole message, that being proactive saves you in the long run as a community, as an individual, and people should be thinking about, how do I make a plan? How do I plan to evacuate if something happens immediately? If my basement is flooded, then what do I need to do? Where do I go, and how do I keep my family safe? If I run out of power, which is another very common thing that people experience, and do we have all those things in place to protect ourselves and our family?
Any further questions from Blackbird?
Yeah, I know you just had a release yesterday, but maybe can you highlight for me just what steps you're taking to protect the community as migrant workers start coming into the farms? What kind of relationship are you working with the farms out there, and what's being done?
So we do have our team of inspectors who are working closely with these farms and ensuring that all these migrant farm workers who are coming in our communities, they are doing the 14 days self-isolation as per recommendations, that they are doing it, and our inspectors are making sure that the facilities where they are doing their self-isolation is is safe from a public health perspective, and they are working closely with all these farms for the same thing, is early identification. If someone develops any symptoms, that how do we triage them and get the testing done. So all those measures are happening right now, and our inspectors are in contact with all of these farms for any concerns that they have.
So we're already seeing people coming into the community? Or just the measures have been set up for that?
Yeah, well, the people already started to come. These measures are in place. We were in contact with these migrant farms since the beginning of all of this, and we had all these process in place for them to do all of that. And now we are actually starting to see people coming in and are being housed in those temporary shelters while they complete their self-isolation.
Any further questions from the Windsor Star?
No, thank you.
CBC?
Nothing.
Amy 100?
All good, thanks.
Windsorite?
I'm good, thanks.
CTV?
Is that all she wrote?
That's all she wrote.
That's all she wrote.
Thank you.
All right. Thank you.
Thank you.